But I think what happens a lot of times for especially women who, own their own businesses, work very high functioning in their jobs. Suddenly, all the things, what you described, I think is so, so important, because all the things you needed to be in that space are not working. And then you just go, it's like you feel so lost with a brain that can no longer tell you how to get unlost.
Welcome, and join us for the Hope, Health, and Wellness Advocacy podcast, informing and empowering you with Tara Adams. Thank you for joining us today on the Hope, Health, and Wellness Advocacy podcast. I am so excited. I have been waiting months to be able to bring my guest to you today to share how wonderful a person she is, but also what she offers. I get to talk with Mattie Cummins, counselor and joy coach. She fills many roles. It's hard to pigeonhole her, so to find a word to describe her would only do a disservice to everyone. However, I'm going to explain to you really quickly before I even let her talk, kind of how she and I met. I had a car accident at the end of 2019, and it ended with post-concussion syndrome, which, if you're not familiar, is not something you want to have after any kind of traumatic brain injury. And it was a really rough recovery. I was not doing well. And this was during the pandemic, because shortly after the accident, the world shut down. So that was a double whammy on top of everything. And I actually reached out to Dr. Bennett. She's a great doctor. She herself has had TBI and post-concussion syndrome. And she was really helpful in helping me identify great players in helping me recover. And Mattie was one of the most instrumental in the placement of the team, if you will. Mattie helped coordinate my care and helped me to understand how each leg of my therapy, how it was benefiting me, how the challenges and the stumbling blocks that came with it were actually good things, or how they fit into the bigger picture, and really encouraged me, which is so necessary, particularly in a process like that, because I was so scared that I would never be able to read functionally again, or see well, or be able to use my mind to just think the way I used to. It was really a scary space, and Mattie took the fear out of it and really held my hand. And I would say we worked together closely for 18 months at least, and continue to work together to this day, not as intensely, but it's still a process. Post-concussion syndrome is, and I still have issues to this day that she helps me to understand what is happening, who's the best, what is the best therapies or treatment options, and we go and discuss it. So I would like Mattie to kind of take a moment to discuss from her end kind of what she does in general, but particularly in my case, since I'm giving her carte blanche and HIPAA relief, to talk about how we work together and how that would look similar for someone else who might be going through either traumatic brain injury, post-concussion syndrome, or any kind of neurological brain issues that they're not getting good help for. I'm going to let you take it away, Mattie.
Well, it's absolutely an honor to be here and to do this side of things with you after we've been meeting for so long. But, I think the journey you described for yourself is incredibly accurate. What's your life? But also for most people, it's the same. And it's so confusing for anyone with neurodiversity. It is so confusing. It is so challenging. And you get all this bombardment. I mean, the good thing is we get lots of information these days. Bad thing is we get lots of information. And so you get all this bombardment. And so I see part of my role. So I'm a social worker, I'm a counselor, I'm a coach, I'm whatever people need me in the moment, which is what I think is really powerful about what I do, because it's very versatile. And so the reason I'm saying that is I think a big part of our journey together and what I do for other people is really just education. Like, it's this, you get all of, well, sometimes you don't get information, very much like you didn't in the beginning, right?
Right.
And so it's giving information, but then taking all of it and making it make sense to your life and your function and where you are.
I
So
love
I
that.
think one of the things that's super powerful is just and I think we started here when we started working together, is your brain is very different than my brain. And so every injury is different. Every person's different. Every experience is different. And so to be able to move through all that, especially related to PCS and the TBI, helps to kind of start teasing out, okay, this isn't forever. This will change. And just giving people the grace to be on the journey too. That makes sense.
I love that. I love that. And I want to add that it's not just education, it's support. And that's such, for me, my brain is everything. I talk nonstop. You can ask anybody in my family. I write for a living. I analyze for a living. I read for a living. Those are all brain intensive activities. So if my brain is even at a 10% deficit, I immediately feel it. And it was far more than 10% that I was at a deficit. And it affected everything. And your brain, when it is not working properly, it also affects hormones. It affects the rest of your body. It's not just one thing. So it's terribly scary place to be. And then, as you said, there's a lot of information. That's a good and a bad thing. But when you're compromised, it could be like just saying hello, and that's overwhelming because it's too much for the brain to take in. It was a thankful thing I had a background in it before I had my own, because my son had a really bad traumatic brain injury years before. So I was educated on how just simple hits to the head, if they're in the wrong place, can result in months, years long battle with just trying to recoup the foundation of where you were. And also just how the brain is affected. I mean, it's hard to describe until you've had an issue, but like everything involves the brain, everything.
Well, and I appreciate that, because I think the education, while that's a big piece of what I do, it's also a process of understanding what you're hearing. But I think what you said is what you don't realize until you've had a brain injury, is your brain controls everything you do. It controls your body. And even for people that I work with that aren't necessarily, because I do a variety of things around, just anxiety and all those other things, but our brains affect all of that. And so this ability to stop and go, one, it's your brain, right? It's not you, it's your brain, I think is huge. But then to help people comprehend what that means in their own personal life, and give them permission to not be okay. It's okay. And one of the things I think that was so powerful about our work together is, and I think for me, when I work with women who, I've often said, and I've said this week, if I'm ever have a brain injury, all of the people I work with better watch out, because I have way too much information, like to be in control. I like perfection. It's all those things I work on. But I think what happens a lot of times for especially women who own their own businesses, but work very high functioning in their jobs. Suddenly, all the things, what you described, I think is so, so important, because all the things you needed to be in that space are not working. And then you just go, it's like you feel so lost with a brain that can no longer tell you how to get unlost.
Everything is so much. Everything is too much. Everything is overwhelming. Everything is like, so that's why you were such a godsend, because you filled many roles that were so necessary. Because if you had only been able to give me education, that would have been helpful, would have been very helpful. And I know you would have been really great at it. But without the support of, particularly when you're compromised with your brain going, okay, well, if this, then that means, and the anxiety part of it is real, like, because you're thinking, will I ever be able to do, I had an entire business around what my brain could do. So if I can't do what I was doing do I have a job? Do I have a business? And who am I? It's okay to be not okay. That was definitely the core of you helping me understand that. And I've taken a lot of that to this day. I mean, again, PCS is still with me, but I don't have the standards I used to, or the bar that I thought I used to have to keep. And, you know, the world is still spinning.
It's crazy how that works. Yeah. Yeah. And I think that's, you know, and so that support piece is also the coaching and the counseling and also the social work, right? Because I think what makes my background so unique is that I have all of those pieces. And so one of the things that you mentioned when you started introducing was just all of the people that were involved. There were all these people. And that in itself is an overwhelming. And I think the anxiety and the fear is real, because if I don't do this, like you said, if this, then what? If I don't do this, then what? And so just to have someone to kind of stop and say, okay, well, that's what this means. When you go, you know, if this is happening, it's going to affect this part of your life. Because part of what I think is really a good thing about getting into rehab is that they're so focused on getting you better. However, that is tunnel vision. And they have to have that tunnel vision to get you better. That's what they do.
Right.
And so to have someone back up and go, okay, wait a minute, you have a whole life that you have to live. And so how do we look at all of the pieces instead of just that one piece? And that's that to me, I am so honored to be a part of that journey for you and for other people, because it's just, I know after doing this work for so long, I know how difficult the journey is. And I know how hard it is to figure out how to maneuver through things, almost like this puzzle piece with a brain that isn't yours, right? And that you very different.
I want to take a minute to go back, because I don't know that people really know my journey, but I also want to put a pin in that to discuss what I think the typical journey for someone who has a brain injury, and it could be small. We're not talking about, and I forget his name, forgive me, the football player that you know, had a terrible TBI. I think it was earlier this year, or maybe it was late last year, where laid him out on the field. We're not even talking about something that is pretty unquestionable whether or not, I think that might count as a TBI. I'm talking about the ones where you get in a car accident. Mine was considered a very small car accident. There was actually even no damage on the vehicles. I counterpoint that with, I took it all.
Right.
Thank you, Subaru. But you know, even my son, when he had a typical playground incident, it just happened to be in a place that's very not where you want it to be. If you get hit, it just really was a bad spot, more what his was. And mine, I think a lot of my complex issues that I brought into the accident is really what played a factor. But also, as I understand it, I had multiple brain injuries prior to this, and that adds into it. But the typical person, I believe, through my conversation, many conversations I've had since this happened, trying to figure out, am I crazy? Am I the one that's got a problem? What I would say is the average is, you have an accident of whatever type, you go to the hospital, you go to the ER, you go to an urgent care, and they go, yep, that looks bad. Let's do imaging to make sure there's nothing internally really bad. So bleeding is primarily what they're looking for. So they do that. And I would say most times, most everybody I talk to, there's no bleeding. Thank goodness. If there is, then you're in kind of a different category that we're going to be talking about. But assuming there's no blood, no abnormalities they find through the imaging, at that point, most people get oh, you're good, just rest it off. And the old studies, the old advice was, go home, lay down in the dark, and don't do anything. You can't read, you can't listen to anything, you can't watch TV. And that was the advice that Ryan, my son, had gotten when he had probably 10 years earlier, it wasn't quite that long, probably 8 to 10 years, he had had that advice, and it did not serve him well, but he was younger. And of course, he didn't listen as much as I probably would have given that advice.
Right.
Um, what we found out through a lot of therapy he had afterwards, he had vision therapy primarily was his therapy afterwards. And that was because we'd done vision therapy prior to that, and he had actually had regression. For me, my complicated issue is I went the route of emergency room, getting the x-rays saying everything was fine, and kind of more or less being told, well, is it really a problem? Are you like, do you need to do anything? And I'm like,
Right.
yes, I'm having like a 10 out of 10 headache. I can't see, I can't stand straight. I'm in constant pain and there's no relief. I to this day, I can't even describe the level of pain and just and the constant aspect of it, and not being able to see because it hurt, not being able to listen, everything hurt so bad. And they were like, okay, well, we've got this concussion clinic you can go to. Well, that's a fine system and protocol they've got, but it's rooted in old information. I'm saying this because that's what I found. But even if it hadn't been, let me just explain to you how this concussion clinic was set up. It wasn't set up for those with a concussion, let me tell you. It wasn't even set up for those with a mild headache, because my first visit was accompanied by my husband, who had to help me in because I was still wobbly and I couldn't see because of the sun and lights. I get in there, bright fluorescent lights, huge TV, biggest TV I've ever seen, with football playing loudly. The staff are yelling at each other in the hallway in the back as I go to try to sign in. And I'm like, yes, I'm here for my appointment. I'm Tara Adams. Is it okay if I wear my sunglasses in here? And they kind of act like I was being dramatic. Like that was the whole thing. Their clinic is set up for young teenagers that are in sports. That's really what it was set up for. Anybody outside of that was not really their wheelhouse. They would look at you and do a few things. And I can't say that it was really helpful to me at all. I think I got some meds out of that, and then was told to go to one of their in-house rehab, physical therapy, occupational therapy, that type of thing. I can tell you none of that was helpful. And then when the pandemic started and we were on shutdown, I was like, well, finally, maybe I'll just stay home and rest. That should be good, right? No, that was not good. And so from there, I really looked like before, like I was going nuts because I just thought I am losing myself. And that, how much of that was pandemic and how much of that was, post-concussion syndrome, but nobody had talked to me about post-concussion syndrome. I learned that through Dr. Bennett and her social media and kind of really understanding, like I thought she would know and understand what I'm going through. And she did. She was very helpful. Working with you and kind of getting the team together. So my therapy looked like vision therapy, occupational therapy, physical therapy, working with you on exercises that we did together. And I feel like I'm missing somebody in there. I feel like there was another one, but that was a lot. So I had like a full-time job of working on all the different aspects. And so legitimately would be overwhelming, but then when they would converge and my brain would like, okay, we're working as hard as we can, and it would flip out and I'd be like, oh no, Mattie, I think maybe there's no hope. Like that was where, so if people want to know, like the average care is just hope it gets better, do some clinic, do some rehab. They'll have you do things and your insurance will generally pay for it, but you're only going to reach a level, particularly if you have any complications or anything going into it. And what I did was worked with a doctor who was familiar with brain injury, had been through it herself, who understood the complexity of it and how there's new research and there's more capability of rehabbing the brain than I was led to believe. and then enlisting all of those factors, all of those people, and then having someone to help me coordinate and understand how all of this fit together. And do I still need this? Do I have to do it, Mattie?
Right. Just stop.
And so that's how it looked for me. So I'd like it for just to take a moment for you to say what you find, because you see more brain neurological issue people. That's what I've found, and just my very unscientific, observed, just talking to people, trying to figure out if I'm at all crazy. You have a little more background and years of really working with people. Would you say what I'm saying is fair or accurate, or have I got it wrong?
No, I think it is fair. And I think part of the difficulty, and you and I have talked about this at length, is part of the difficulty is we're still running on an old medical model. Not only old information for the brain, but an old medical model about people. And so what I referred to earlier was just this kind of tunnel vision around, the therapist. That's the medical model, as I see, whether you're doing this or this or this. What often happens if people these days get an imaging at all, it's in the ER, it's shocking. It is so difficult. So you have to have, if you have a car wreck, and one of the things I think that's really important that people understand is that when you go into the hospital, they classify your injury as mild, moderate, or severe. That has nothing to do with the functioning. That is a medical terminology that they have to come across for insurance. But if you have they're medically mild brain injury, and you're in the ER, chances are these days you're not getting an imaging at all, which is super scary. They say, yep, you've had a brain injury. Here's some information. Go home, rest. Which, yes, but then you'll be good in 48 to 72 hours is what they're told, and then after that 72 hours is when the complications start. Typically, yes, it's people end up. So just as an example, not that long ago, actually last year, I ran across a gentleman who he had this happen. He owned his own business, had this issue happen, exactly what I'm talking about with the ER, left the ER, never got another service because people told him, you're fine. And he'd go see the doctor and they go, nope, you're PCA. You can't have a concussion that long. No. And I saw him 5 years later after he lost his business and his family because nobody was listening. Everybody was saying, this isn't a concussion. This isn't a concussion. And that to me is what is so sad about not having the people that really understand have the higher understanding of the functioning, is that your brain, like we talked about earlier, affects everything. And so if you can get out of the medical model, you're going to need to be in it for some things. I mean, I don't sit around and talk about how horrible the medical model is, because that's not what I'm saying. But I think the difference is when you can get out from under only the medical model, that's when life changes, because you have people looking at you as a whole person, not as no, PCS only lasts this long. No, now, I mean, it's like, you know what I'm saying? So that's what I hope, my hope for people, that they can do that, because you're right. I think when you go into the rehabs and the brain clinics, typically they're in hospital settings. What does that happen with hospitals? We have bright fluorescent lights. We have people yelling. We have all this activity. And I think for me, that must feel so hopeless when you go into a space hoping to get help and you can't even sit in that space, right? So I think that's part of what happens in that journey. And so, and the other thing is there, as I mentioned earlier, there isn't a typical journey, because every person is different and every brain's different, every experience is different. And so it's not a cookie cutter. What you may need, somebody else doesn't need. And so I think it's just, that's the complexity of trying to figure out the journey under brain injury without an advocate helping helping you figure out what you need. It's not even helping you go get it. I mean, Tara, you advocate for yourself better than most people I know, but you don't know what you don't know, right? And I think, one of the things I know too is that you question yourself so much because your brain's not working. So it's like you said, am I crazy? Is it me? What is this going? And it's really having someone to say to you, no, you're exactly where you need to be. I think is important.
I can't tell you how much it hurts my heart to hear about that gentleman and what he went through. That is exactly why I am doing these podcasts and why I am trying to advocate for advocates and for those so that because I credit Dr. Bennett for having been on social media and talked about her journey and talked about it so that when my accident happened and I was looking everywhere pretty sure I was crazy, or I was, it's been a long life of a lot of doctors telling me, no, this is all in your head. You're making it up, accusing me of just being dramatic or oversensitive or all these things. And I think at this point, I own the label of super sensitivity. I think most people would be at this point. But you're right, I do advocate for myself because at this point, I know that the chances are it's doctors who are up to the level that I need them to be, and that I know what's going on because I've gone through several diagnoses over the decades of where I felt it and they were like, I don't believe in that. And then about 5 to 10 years later, they're like, it's a brand new household name of a diagnosis that everybody's got. And they not only believe it, they've got protocols for it and drugs for it and commercials for it. And so I just know now, but I mean, that's what I'm trying to lessen the curve for others. It shouldn't have to be that way. And so, yes, I knew that something was terribly wrong. And as I think I've said to you, and I've said to many others along this journey, this is not how my book is written. This is not how this is going to go down. I am not going down without a fight. And I don't know what it looks like. I don't know how to get the help I need, but I know that I want it bad enough. And I'm doing everything I can, and I'm gonna get some help. And that's what helped me in this instance, and having people like I truly believe were sent to me divinely to help me. You, Dr. Bennett, others, the physical therapist I worked with, she was amazing, and she truly understood it, had worked with others. And I think that's something to mention here is that if you have an issue, whether it is brain injury or post-concussion syndrome or anything else, I find it personally helpful if you can find people who have worked in that community and understand it. Even better if they've come from that, and had a background in that diagnosis.
Yes.
But also, I want to go back and something you said. You talked about how different it shows up, and I think that is also something that is not discussed in the medical schools. It is not something that the doctors necessarily discuss or get as a general rule, just as a general population of doctors. But something I have found true, again, looking on social media, there's several doctors who do deal with post-concussion syndrome and traumatic brain injuries, and they discuss this at length. My reaching out and really paying attention to others kind of in my same situation would suggest that there isn't a typical picture. And I think that's what was a problem for me getting help is, I presented differently than they expected. And two, they didn't have a lot for me because they were like, well, you're not a teenage boy in high school playing football.
Right.
Well, you probably stay at home with kids anyway, right? You're probably good for that, So how it looks different, it could be so completely different that shouldn't keep people from looking for care and advocating for themselves or finding someone who can advocate for them. And that's something I think you did for me as well, is when I would doubt myself
Mhm.
or think or have, you know, again, kind of doubling back on something else you said, you talked about tunnel vision. And I think, you and I worked through issues where I had a very aggressive vision therapy therapist who she had a schedule and we were going to meet that schedule. And when I couldn't meet her schedule of being able to reach or do whatever it was she felt that this week I was supposed to do, never mind the fact that I was seeing 3 and 4 other therapists for different things, and I was having a rough week. And that didn't even include, the silliness of, personal issues outside of that, because I was still dealing with my mom, who was in a skilled nursing facility at the time during the height of the pandemic, and all that stress had on me. It was just the fact of, we got to meet this criteria, and how frustrating, and how, like, I'm coming to you like, well, is there no hope then? Or am I doing something wrong or bad? Or like, can I even do this? Should I just give up on the whole thing? Like, it really was a really bad place to be. And we worked through that. Thankfully, you helped me to see, like, this is maybe not helpful. And you gave me options of how to deal with that. But that was very much a challenge during my rehab.
Yeah.
So I appreciated you being there for that. And I think people should know and understand too, that that's a thing. So just because you get help and you get someone on your team, their goals may be a little different than what your goals are in that moment or what you're able to do.
Well, and I think those two things are very tied up, because their goals are their goals based on whateverness about that. That's my official opinion, whateverness. So whether that's the insurance, whether that's their training, whatever that is. And it doesn't take into account the fact that you do have a life outside who you were before, who you are now, what pieces. I mean, so when I think about, for me, when I think about me having an injury, and that's why, I say, you guys watch out if I do, because I know my biggest issue is always anxiety. But I have worked so hard in my life to get that in a place where I control it and it doesn't control me. That's the first thing that goes after a brain injury. And you can't separate that from the medical things that are happening, or the short-term memory, or the anything, because the brain is a whole piece. And so, in what I think happens a lot in our medical systems, they want to go, okay, we're going to work on this piece right here. We're going to work on the tension concentration. Go. And you're like, okay, but I'm worried about how I'm going to pay our rent. Right. So, and I think the other important thing too is that when you talked about every journey is different, and that's one of the things I say to people very early on, because my injury, I could have the exact same car wreck you have, and my symptoms would be very, very different, because I'm a different person. Experiences are different. The way I deal with things, I mean, I'm just different. And so part of what we do is this comparison game, right? And so and I think the therapist will do this too, not because they intend to, but because this is how insurance works, is how, okay, well, you need to be here at this mark right here today, or no insurance for you. And we can't, I mean, it doesn't work the brain doesn't work that way. It just doesn't work that way. And so part of what I think is that advocacy is being able to sit and go, okay, explain to me why you need to know that information. Explain to me why that piece is important. How does that relate to my life? But when you have a brain injury, it's hard to do that. It is hard for your family. Other thing is, I want to point out, and you know this just as well as everybody else does, is that the other piece that comes into play with all this is that there's an expectation that the family is going to pick up all this stuff and roll with it. Like, oh, okay, well, the family can do it. And it's like, the family's grieving just as much as the person with the brain injury. And so I think that's the other piece. It's just helping people understand that when this injury happens to you, and helping professionals understand, other professionals, not only happens to you, it happens to the whole family. And that's the other piece I don't see, is the family being a part of all of that, and an understanding that they are grieving too.
I appreciate so much you said that, because I am remiss not bringing in just how much a role my family did play. My husband and my son, we have a small little family. Unfortunately, we don't have a lot of outside family other than my mom at the time. She's since passed, but at the time she was in a skilled nursing facility. Other than that, that's our little family. And of course, pandemic happens and we're closed up in a house. So my brain injury becomes a huge issue. And my family loves me. They were so good about picking up the
Yeah.
pieces. That was never a question in my little family, but I could see where that could be in others. But if I had been single, jig had been up. Like, I don't even know if I'd have made this out, right? Like, this just would have been like, all right, this isn't. But having them meant everything to me, and they were so kind. But we did have to have real conversations, like, I'm not capable of that anymore. And seeing them sometimes really try to hold the fear that you can sometimes see come across their face.
Yes.
When, like, I can't remember what you told me 10 minutes ago, or I hear you talking, but my brain is not in a place where I can understand at all what you're telling me. And we still, if I'm tired or I'm having a difficulty, or like I just had like another health crisis a few months ago, and that really affected my brain as well. And it's that fear that I can see them have, but they're trying not to. And little conversation later with you couldn't remember, like, what, could you really not remember? Or like, were you just kind of kidding? Or, it's the delicate conversations. And I credit you for that too, in helping me navigate with my family. Like, here's what's happening, and here's why. Blowing up and being angry is a huge part of brain injury recovery, whether that's post-concussion syndrome or anything else, anything really I've found in the literature as far as of neurological disorders.
Yeah.
Just kind of blowing up. And it's because you can't regulate the information of what you're even feeling or knowing or understanding. So getting frustrated in the moment where it's totally on you, like, I'm not frustrated with them.
Right.
I can't remember. I can't find the word. I can't complete the sentence. I can't remember what I came into the room for. I can't find things. And it's just, it builds up, and then you can't even communicate sometimes. And being able to be told, like, that's okay, that's completely normal, and this will get better as the therapies progress, and this is how we can talk to your family about what to expect and how to work, because they're scared too. Like you said, this deeply affects the family, co-workers, friends. I definitely took advantage of being at home and being just with my little family, because friends, they knew I had an accident. They had no idea what I was going through. At some points I would say, yeah, I'm doing a lot of rehab. And they'd be like, really? Was it that bad? I didn't think it was that bad of an accident, whatever, and I didn't have the capacity really, with all the therapies I was doing and everything that I was doing for rehab, to even entertain talking or meeting with them. So thank you, pandemic, for that. But it was just a situation of, I didn't want to have to explain myself, because it made it more real. And it made me kind of stick in a situation of, this is where I'm at. I don't want to be here. I'm not acknowledging where I'm at. I'm just here long enough to get to the next place. And so my family understood that, and certain close friends that I would, talk with. But I mean, that was like maybe 2 or 3 people. And you became such a good friend. I am thankful that I get to call you friend now, but definitely I could rely on you to say, I am scared, and does this ever get better? Am I ever going to be able to be anything close to what I was? And just being able to have this podcast, to be able to have these thoughts and complete a sentence, I cannot express to you how wonderful that is, considering that that was not a possibility at the height of when we were working together. But the family, I'm so thankful you brought that up. Such a huge, important part or piece in my puzzle. And I really feel for those that maybe don't have that. I hope that they have that. But again, that's where someone like you in your position would be such a huge aspect, a positive aspect of their team and their support system of getting better, because you really provided a lot of support in addition to my little family at the time. Gosh, I'm so glad you brought that up. I wanted to bring back something you said earlier about the 72-hour window, because I think that's something I had never realized or known. And it was so true in my instance. So I had the car accident and immediately I was not well.
Yeah.
I was at one of the first questions they ask you, I guess, related to a brain injury is, did you, I forget, it's worded different ways, but it was essentially, did you act out? Did you yell? Did you get mad? And yes, I did all the things. I was not my best self. But when I got out of the car and I said to the little fella, what the hell were you thinking? Because we were just stopped. Like all I had to do was press the brake. What had to happen? That did not occur. So yes, I was not my best self, but at the time when I was asked, do I need to go to the hospital? I thought, okay, I'm having really bad pain here in my chest and my head hurts. I have a ripping headache, but this is all appropriate, right? This is what we would expect from being slammed into. So I declined going to the hospital. I would never do that again, but I did. And I went home and I thought, I knew from all my other, complex chronic health history, just rest, take it easy. Now, mind you, my husband was in the car. He was the driver. So he too was not well. And so again, when we're talking about family, like he too had to deal with a lot of this. He did not have the same, like, again, two people, same car, same accident, not the same outcome at all, but he was not well. And we get home and I start having really bad chest pains, which was from the seatbelt having basically dug into my chest. But my head, and I would say that took a good maybe 12 to 15 hours. And then at a certain point, it was like, oh my goodness. I mean, I don't think I'm going to make it. This is the pain and everything that it involved. So it's not right away. And that is not a symptom at all to look for. I mean, they talk about like eyes rolling up in the back of your head or throwing up, or, I think of Dwight on The Office when he hits the pole. I don't know if you watch The Office, but that's always, and especially, it means more to me now after I've had, a brain injury, and I'm like, well, that was typical. I mean, he did hit the pole, but like, everybody's isn't like that. And 72 hours is like 3 days before you can
3 days. Yeah. Well, and I think one of the things you said that I think is super important, and I talk about brain injuries, especially after the injury, it's almost like these layers of things. The brain is really in shock. I mean, it's like it doesn't know what happened. Part of the difficulty with, and I meant to mention this earlier, I'll mention it here, part of the difficulty with imaging, and this is the other thing, like people are like, in the medical system is saying, there's nothing on the record, there's nothing on the imaging. There's no, there's no blood, there's nothing on the MRI. Imaging only picks up, like you mentioned, blood, remnants of blood, bruising. But when you have a concussion, what really has happened is the neurons have stretched. The brain has slammed up against the skull. We think about this concussion as a knock on the head, and that's not what's happening. And so when these neurons stretch, the brain then starts reacting, but it's like layers of things. So exactly what you talked about. I have a headache. Okay, well, that'll go away. Oh, wait, the headache's gone, but now I can't see very well. Okay, wait, I'll see if that, okay, well, wait a minute. Now I'm feeling this, pain here. I can't hear well. I can't. And that takes a while for all of the brain, just the trauma, to calm down long enough for you to know what you really have left. often what happens is people then go back to the doctor a week later and they're like, well, then this isn't related to that. You should have come, like exactly what you said, right? You should come in. No, I don't want to go to the hospital. Well, then you're not that bad. And that's just not fair. It's not fair.
It's not accurate. It's not accurate.
It's
I
not
mean,
accurate.
that definitely followed me with everybody from the car insurance to talk about it, but also, like you said, the medical insurance and doctors being like, well, you didn't come in right after the accident.
Well, what's the problem? I mean,
Okay,
you didn't go to the
I
hospital?
didn't. I didn't immediately assume that, anyway,
Yeah.
but just felt like being punished for trying to make the best decision in the moment.
Oh, yeah. And I
trying
think
to listen to, in
yeah.
other words, yes, there was an appropriate amount, I would say, for what I had been through of a reaction. Didn't say that I was just skipping along perfectly fine. I had a reaction. I just didn't think it involved the hospital. But I tell you, I hear other people calling the hospital for all sorts of things. I don't call the hospital, okay, for many reasons. So I think I got slammed in the back, and hey, I've got bruising in the chest and a headache. That sounds appropriate, and hopefully I will get better. But guess what? Ooh, did I not get better?
Well, and I think that's the problem too with the medical system is they shame you. And again, it's not an intentional thing. It's the way
I don't think it's intentional, but it definitely happens, and
it's the system. Yeah. And so it's this, well, you didn't come in then, so what's the problem, right? And then if you go in, they do it too. So you can't win. But I just think it's important that people know just because you go see a doctor and the doctor tells you something doesn't mean the doctor is accurate. It doesn't mean that's accurate for your story. It doesn't mean it's accurate for, and you. This is why I'm so glad to know that that people also have people like you, because we are designed to not argue with the medical system. And it's having people say to you, no, you get to feel that and you get to do that. And I think not all doctors are that way. I have been part of the medical system. Trust me. I mean, this isn't a carte blanche, but we are just, our culture just is designed to not question. And you can't do that with this kind of injury. You got to question. And sometimes you don't have the capacity, so you need someone to help.
Amen. I completely agree with everything you just said. I too am not trying to completely be down on the medical system.
No.
Part of this whole idea of this podcast and the information that we share is so that you understand how to make the medical system work for you.
That's right.
I think it is there to help, but you have to know how to make it work. You have to know how to duck and weave from the doctors who would tell you, no, you're perfectly fine, or no, you don't have a concussion when you have a blazing concussion. So that's what this is about. It's just trying to work with the medical system we have to get the most out of it. And I absolutely love earlier that you said no insurance for you. I love that, because it certainly feels that way at times. Like if you don't do exactly this, that, and the other, and I can't tell you how many times that came up in my rehab was people talking about, well, we have to try to figure out how to get, insurance, the information they need, and this, and then, it's definitely that. For me, everything wasn't about insurance, because I told them, I'm going to pay for this. My brain's got to get better. I'm going to get better. So whatever, I'm paying for this, just say I'm paying for it outright. Even if I don't get to retirement, at least I'm going to have a brain before I get to retirement. And we're going to work on that. But the insurance, no insurance for you. I love that. I need a shirt written up, because I think
it's exactly
that's awesome. And I think it's accurate, unfortunately.
It is accurate. Yeah.
Okay, so this is the time in an interview where I like to ask the questions that I think are not necessarily completely focused on what we've been talking about, but I think are helpful. And the first one is going to be your favorite recipe, and it can be for any reason, but I'd love to know what your favorite recipe is and why.
My favorite recipe is cilantro chicken. I am not a cooking. I don't love to cook. And so mostly because I don't like to clean up, just so we're clear. And so I have a crock pot recipe for cilantro chicken. You throw everything in, you leave, you come back, you slap it on some rice. And for me, I try really hard to not eat inflammatory foods. So it's gluten free, it's dairy free, it's all of the free, very healthy. And I love cilantro.
Awesome. And cilantro has a lot of, it's a
Does.
detox, I believe, right?
It is
To
a
get the
detox.
metals out, or
And yeah, it's a detox. And then without, it has very little any kind of ingredients in it, very few ingredients. And my 12-year-old loves it, which is even better because he doesn't eat very much. So that's one of our weekly go-tos.
I love that. I'm with you. I'm not a great cook. I don't cook well or often. And so I love a slow cooker recipe
Yeah.
too. And I love that it is free because I too need to avoid quite a few things in my diet.
Yes.
So that would
Yes.
work well for me.
Yes.
Awesome. Okay, next question is the best advice you've ever been given. What is the best advice you've ever received?
So the best advice I've ever been given is, and I had a friend say this to me, is I was, I was talking about something and going off, and this was one of my mentors actually looked at me and said, "Would you say that to a friend? Like, would you say that information to someone you know?" And I'm like, "Well, no." And she's like, "Then why are you telling yourself that information?" And and I use that in my counseling and my coaching because I think it really forced me to take a look at how much my brain was doing automatic thoughts. So that was huge. The best advice I've ever given, I should be asking you that question. I think the best thing I can do for people and the best advice I can give to people is it's really okay to not be okay. It's okay to be in a space that it's a bad day and life isn't going, and it's okay to not be positive all the time because that's what we feel like we have to do. It's really okay to just not be okay.
I do love that. And that it's simple, but it's so profound, and it really meant a lot to me because um, I struggled with that during
Mhm.
my rehab, and I struggled with that for a lot of different reasons prior to ever having, brain injury that needed
Yeah.
rehab. But I remember to this day, some days I wake up and the systems are not a go. Things are not happening the way
Yeah.
they should. And I remember, you know what? Okay, maybe today's just not going to be that good of a day for whatever it is I had planned. That's okay.
Hmm.
And we're going to go and do something else. And that was a big part of rehab for me too. And something that I think was really helpful is just, and I have the luxury of, my child is now in college, and, I have my own business, so I can rearrange things. But for the most part, I think where people can and wherever they're at, make it okay. Make it okay that today's just not a high vibe day. Today's not going to be, I tell people now, I'd love to visit with you, but I'm not going to be very, happy or, all this stuff. And I'm okay. I'm not depressed or suicidal. It's just not one of those days. And if you don't want to do that, okay, cool.
Okay.
But that's how it is. So I really appreciate that. I think that is a really good advice to give, and I appreciate that so much.
Mm.
One last thing, what is your favorite book? I know that's hard to say one favorite
It
book, right?
is. Well, it is. I think my favorite book, that has probably the book that has made the biggest difference in the way I think is, and now I just lost it. So see, I call it a contagious brain injury. Like, pick up people's symptoms from, so this is my short-term memory. It's Jordan Rayner. He's an entrepreneur, and he wrote several books. That the one that was my favorite was Master of One. There it is, called Master of One and Called to Create. Those are both the ones. But Master of One, I think, is such a beautiful discussion around how all of us are creators. And this really changed the way I thought about creation, because I will tell you, I'm not a very creative person. I'm trying to learn how to knit right now, and it's not going very well. I don't draw well. I don't like but that really changed my own perception around creation is everything we do. And how we master that skill is really super important, because then it's what we give to other people. So
I
it's
do
fun when
love
your
that.
guests can't remember the name of the book.
That's just because of what we're talking about. You were just keeping it, in line with what we were talking about.
I know.
No, I love that, because I actually want to read that, because I feel like I can identify with that a lot. I have a lot of creative friends, a lot of do-it-yourselfers, or people who have art and they go to art shows to show off their wares. And I have a lot of attempts at things that I could show you.
Right.
But not anything that I could be like, oh, Tara does XYZ. But the sum total, I feel like I've really also, because of my health background, I've had to prioritize things, and my priorities were raising a child that I was very proud of, and that I gave the best I had for him. That was a priority. And now that he's graduated and I've graduated from that, next step is now trying to really just advocate for myself the way I tell others to advocate for themselves, and also to help others advocate, and to take what I've learned about this system and make it work. And so
I think what I love about that, though, is that is your creativity. So that is, and when people say, what if people said to me now after I've read that book, what is your creativity? My creativity is people. I mean, that's where I shine, and where I could do that, just to hang out with people all day long. Now I'm an introvert, so it has to be for but it's just, I think what's so beautiful about what you do is, and part of this unlayering, I think, of life is, your creativity was with your son and your own business. And now that your son is graduated, it's like, okay, so the creativity then can be filled with something else. But it's a beautiful concept, I think, to rearrange your brain around what creativity is and what we bring to the world.
I do appreciate that. That is a great thought. That's a great book.
Mm-hmm.
Awesome. Thank you so much for meeting with me today. I really enjoyed our conversation, and I hope that others get that there is hope if you've had a brain injury, and that there are people like Mattie, and Mattie is available if you'd like to work with her. I will have links to your website and to your Facebook page, and all the things that people can work with you. But yeah, I mean, you're taking people all the time as a coach, and can help them in a lot of various ways. I chose to start with you as needing brain coaching and brain coordination of care, as well as just helping me understand what was happening. But I love that you have a varied background, and there's a lot of ways that people can work with you. What are people that you work with, like right now? Who are you working with that are really able to, you can create with them, you can make them happier, healthier people, like you did me?
Well, one of the things I've realized is that even no matter whether it's brain injury, whether it's COVID, we're still living with the effects of COVID, people. All of these things. What I've realized is what the purpose of these purpose that we're looking for. One, we're looking for a purpose, but also that there's this process of finding joy. And what I mean by that is, joy is not happiness. It's not in the moment, but it's being able to, just like you did, Tara, you were able to, circle yourself around people that gave you the hope to see through it. And then to start going, okay, so what am I learning through this process? And that to me is the joy. And so one of the things I'm super excited about, because I also know that accessing private people can be very expensive. So I actually have my first workbook coming out around how to reframe our brains and how to retrain our brains to live in these moments of joy. And then I will be adapting that here super soon to be for people with brain injuries as well. So that people have access when they don't always have the funds to do that, and which is that's my creative coming out and how to help people in many, many different ways.
I love that so much. I'm so excited. I didn't even know that. So this is awesome. I'm so happy to hear it. I'll probably be one of the first ones to get my own workbook. I want to say you said several words in there. You talked about hope and Hope Health and Wellness podcast. That's what we're on. That's what I'm here about. But you also talked about joy, and fun fact, my middle name literally is Joy. I'm not even making that up. That's
right. I remember that now. Oh my gosh, look how that works. I'd forgotten your middle name was Joy. Yeah.
Literally is so I love that people can, for me, it was the best money spent. I actually think you were very reasonable for your sessions and for the just impactful way that we got together, and you were definitely helpful in how you would work with me on that. But I can definitely understand that for those that maybe that's a stretch, or they're not sure yet really what they need or how they can work with you, this would be a great way to do that. And I'm so excited. We'll have information about that and share that as that comes out.
Absolutely.
So that people can definitely take advantage of it. Yeah. Thank you so much. I really appreciate your time today. And we'll have to do this again sometime.
I would love it. I would love it. And thank you. I'm honored to be here.
Awesome.
Always fun to hang out with you.
Thanks so much.
Be empowered. Be your own self-advocate. Check out our website, hopehwa.com.